Hello everyone and welcome to Inside Healthcare. It's the cold and flu season and we begin this program talking with the Minnesota infectious disease specialist about what you need to know to protect you and your family during this flu season. And we're very pleased to have back with us Dr. Peter Bornstein. Thank you. He's with the St. Paul Infectious Disease Associates.
Nice to join you again, Jodi.
It's been a couple of years, I think, since you've been here.
A few
You've been
years.
Very busy the last couple of years.
Yeah,
so.
Last year was the year of Ebola, so fortunately we're not dealing with that so much anymore this year.
And you know, the flu, it comes around every year and people maybe don't take it as serious, but it's a very serious problem in that people end up in the hospital, some people even die from it.
Right, so the flu can vary from year to year, as you say. Some years are worse than others, but pretty reliably every year hundreds of thousands of people get sick and thousands of people end up dying either from the flu directly or complications of having had the flu. So it's a very serious illness.
So who's at most risk and why are they?
The people at highest risk are those over the age of 65, children under the age of 2, or pregnant women primarily. And then anybody who has a chronic health condition or an immune system disease, respiratory disease, these people also are significant risk of getting complications of the flu.
And just because they have a weaker immune system for the most part? Or?
For some of it, it's the weaker immune system. For others, what the flu does directly to the heart and lungs can cause further problems if they already have heart or lung disease. So for a couple different reasons, the flu can be a problem.
You know, and before we get into the flu vaccine itself, you know, I think a lot of people can confuse, like maybe they have some other kind of virus or something, but what exactly is influenza?
Sure. So you called it cold and flu season, and that's right, because we have both the flu coming around and also common colds. And the difference between the flu and the common cold is both that it's a different virus. The flu virus is a very specific virus called influenza. It's what we call a respiratory virus, so it attacks the lungs and the respiratory system. Cold viruses also can attack the lungs and respiratory system, but they're different viruses, and there's whole families of different viruses other than influenza that cause colds. Influenza is significant because it tends to be much more severe than common colds are.
And the symptoms, it comes on suddenly, usually?
Often comes on suddenly, often associated with very severe achiness, high fever, very sore throat. Certainly early on, it can be difficult to tell the difference between a cold and a flu. But for those people who've had the flu, they'll tell you, I could tell the difference between the flu and a cold.
So why should we be vaccinated against the flu?
Well, again, for most of the people who are at high risk, there's pretty clear indication to be immunized, that there is some protection. For those of us who may not have a health condition, we may want to protect those of us around us who do. So if you're a caregiver of someone who is in the high-risk group, if you're a hospital worker, healthcare worker, these are all people who should get the vaccine, if not for themselves, at least for those around them for whom they're providing care.
I was thinking even like teachers maybe, or things like students.
If you're around children especially, or you're around ill people, or you work in an environment where there's lots of people coming and going, I'm thinking about the people who take the tickets at the movie theater. You know, if you're around lots of people during flu season, you would probably benefit from getting the flu vaccine. It would help you, and it would help the people around you. And
you were telling us before we got started that you've even started to see some cases already in the hospital.
We're finally starting to see some cases now. It's late October, and this is around the time when we typically do start to see some cases. Sometimes it's earlier, sometimes later, but right now we're starting to see cases showing up in different emergency departments around the area.
And typically in this part of the country, it peaks around right after the holidays, around the holidays, the end of December, 1st of January?
Right. For the strain called influenza A, yes, the typical peak is around the holidays, whether that's people coming together during the holidays or
hugs, kisses,
yeah, all those things.
Sharing things.
But typically influenza A, yes, your peak is late December, early January. And then influenza B, which is another different virus, but also part of the influenza vaccine, those tend to be later in the spring, March, typically February, March. So there are several strains of flu virus circulating during the season.
Now I know CDC had said that last year's flu vaccine, last season's flu vaccine, was not quite as effective. Some people got the vaccine but still got the flu. Some did.
Yes.
So what do we know about this year's flu vaccine?
Well, we don't have enough data yet because it's so early in the season as to how good what we call a match it's going to be. Typically, they do try and match them pretty well, and I haven't heard that there's any problems yet with the match. But you never quite know until the flu has become widespread if you have a good match or not and how effective the vaccine is going to be.
But even if you haven't gotten it, it's still not too late to go get your vaccine.
It's never too late. And people always ask me, what's the best time to get the flu shot? And because it can take 2 to 4 weeks for the immunity to kick in after you've been immunized, I tell people, well, if you know when you're going to be exposed, then you want to get the shot 2 to 4 weeks before that. But most of us don't know. So,
I have no idea, yeah.
It's really never too early to get the vaccine. And it's also never too late as long as it's still flu season. Because even if influenza A has already come and gone, there's still influenza B out there. So you want to get immunized when you can.
So what's the difference between the flu shot versus maybe the nasal spray? I mean, who should get one, and what's the difference between them?
Sure. So the flu shot is what we call a killed vaccine. And the killed vaccine means that there's pieces of the virus in there, but not the whole virus, and you can't actually get the flu from the shot. The nasal spray is a live virus vaccine, and that means that this is actually giving someone a dose of flu virus. It's what's called a cold adaptive flu virus, meaning it doesn't grow in warm parts of the body like your lungs, so it shouldn't cause any lung or respiratory disease. But nevertheless, it is a live virus vaccine, and there are groups of people for whom the flu mist or the flu nasal spray should not be administered. Typically, it's people over the age of 50 should not get the mist. Very young children should not get the mist. People who have immune system problems should not get the mist. So they'd be safer getting the shot.
So preferred probably to get the shot versus for most people, I would think. For
people who are at high risk, they're probably going to be getting the shot. Mm-hmm. For those people who are at low risk but want to get immunized and don't like needles, then the spray would be fine.
What about, we're hearing a lot about the high-dose vaccine.
Right.
What's that all about?
So a high-dose vaccine has 4 times the amount of immune-stimulating properties that a standard vaccine has. And it's primarily intended for older people who already have an immune system that naturally weakens as we get older. And so the high-dose vaccine is recommended for people over the age of 65. People younger than the age of 65 could probably get a significant enough immune response from the standard vaccine.
So with all of the different vaccines, what are the potential risks associated with them?
Well, the biggest risk, and the one I always get, is a sore arm from when the vaccine's given. I always figure, well, it must mean I have a good immune response because I'm getting a sore arm. If you're talking about the shot, that's really probably the main risk. It's just what we call a local reaction. Some people will get maybe some achiness for a day or two, but most people just get the local reaction, if any reaction at all. There is a special shot for people who have an ag allergy, which is sometimes significant for some people. Mm-hmm. But generally speaking, the shot is well tolerated. And that's one reason that the Centers for Disease Control recommend that anyone over the age of 6 months get a flu vaccine, because it is so safe and has such low risk compared to actually getting the flu.
And in past years, it seems like we've had shortages of the vaccine, but we're not seeing that this year.
We've heard that there's good supply this year.
Mm-hmm. So what other infectious diseases are common this time of the year that we should be aware of, and are there things that we can do to prevent them as well? Sure.
So not just preventing the flu, but other respiratory infections, rhinovirus and other viruses like that. The principal thing is good hand hygiene, so washing your hands, especially if you're in large groups of people before or after you're with them. We have the concept of cover your cough. So if you're going to cough, try and cough into your arm, not into your hands. Because if you cough in your hands and then you shake hands with someone, then you're potentially transmitting the virus. Those are probably the principal ways to prevent infection, whether it's the flu or any other viral infection.
Anything else that our viewers should know about protecting themselves and their families from this year's cold and flu season?
Well, the most important thing about the flu vaccine or any vaccine is that the more people who get immunized, the less chance we all have of getting the flu. And so it's especially important for not just for people who have the risk factors themselves, but for those around them who may be healthy but could potentially transmit the flu to them. It's important to get immunized. It's really the best defense we have against getting the flu.
Well, all great information as always, so thank you so much, and a pleasure having you back with us.
My pleasure.
We'll have to have you back again.
Okay.
So, thank you. Thank you, Dr. Peter Bornstein.
You're welcome.
Morning, Gary. We are GetSchooled.com. You want a college education, don't you? Gary, financial aid forms. Biology homework, G. Picking a college, man. You and us go together like tacos and Tuesday.
And I love tacos.
Whether you're going to see your doctor for the flu or have routine tests, it's important for you to understand information about your health. But too often, health information can be complicated and confusing. Since it's October and it's Health Literacy Month, we take a closer look at this issue and what you should know before your next doctor's visit. And joining us, we're glad to have back with us Dr. Carolyn McClain, Medical Director with the Urgency Room. Thank you for being with us.
Yeah, thanks for having me.
So how big of a problem is this, and who's most affected by if they don't understand what's being told about their health or about their test or about just general information?
So I think everyone is affected by this, and I have a couple examples from things that just happened last night at the urgency room. So I had one gentleman who was just discharged from the hospital, and he had pneumonia. But during his stay, he had been diagnosed with high blood pressure. So he'd gone home on a new high blood pressure medicine, and he'd taken the medicine twice, and he'd checked his blood pressure every 2 hours for 40 hours, and his blood pressure had just gone down a little bit. And so he came in to see me because it wasn't working, and he knows high blood pressure is very serious, and how do I fix this? And what we didn't communicate with him is that his blood pressure was not going to get fixed quickly. Oh. It takes a while, and you can't, he's on a very low dose of blood pressure medicine, and it takes a while to ramp that up to make sure you get the right dose, and he should expect his blood pressure to be better in 2 to 3 months. But in his mind, his blood pressure was really important, which it is, and it wasn't fixed. So we didn't set the expectation that it's going to take a while. So another example of this is when you have your kid has a cold or a virus, and they have a high temperature, and their temp gets, scary temperatures. They get to 105, 103, and you give them Tylenol, and it comes down, and 3 hours later, it's back at 105. That's exactly what happens. But parents don't always know that. They think, well, the Tylenol's not working. Well, it worked for 3 hours. That's all it does. So we have to get better at explaining what you should expect so that we can help you to get through your illness. Because most of us in medicine, we know exactly, oh, this is going to last 5 days, and you're going to have a fever, and it's going to go away for 3 hours, then it's going to come back. But we don't explain that to you. We just say, you have the flu, and you're going to be sick for a little bit, and take Tylenol and ibuprofen, and you think that's going to make it better. It just makes it go away for 3 hours.
Plus, it seems like when you get this long list of here's the things that you should know, and it goes in and out without, what was that again? Or if they tell you and you're you have a sick child and you're only half listening or something like that.
Yeah, and there's a lot of information on the internet, which is good, but also kind of a fear-mongering because people get really worried. So another example would be in a communication issue is a gentleman came in yesterday who had knee pain, and he had knee pain for 2 years. So in my head, I think, okay, you've had knee pain for 2 years, so why tonight? Why are you here tonight? And he has a whole reason why he's here tonight. It really hurts, and we do an x-ray, and I go in and I tell him that the x-ray just shows that this is arthritis. It's probably going to hurt. These are some things you can take. And he says, oh, thank God, because my best friend just got diagnosed with bone cancer in his knee, and his leg needed to be amputated. which is why he was there that night.
Oh, how frightening.
But the communication issue, like I could have told him he didn't have bone cancer, but it's hard for you to even communicate that to me because that would be putting in words something that you're really afraid to tell me.
So what should our viewers, when they go to the doctor, whether it's the urgency room or to the doctor's office, I mean, what should they do to help improve this communication, get rid of some of this confusion and things like that? So
I think two things. One is be honest about why you're there, because a lot of people don't want to tell you that, you know what, my mom died of brain cancer, that's why I'm afraid of this headache. They don't want to have that conversation, and it's a hard conversation, but it helps me understand what you're afraid of, and it helps me, one, that's good information for me to know that that runs in your family, and two, it helps me help you. Then the other thing you want to make sure you are clear about before you leave is, when am I going to get better? How long am I going to feel like this? Is it normal to still be sick in 2 days? And when do I have to come back? When is it not normal for me? For example, if you're throwing up, I can give you medicine and it's going to make your vomiting better, but it may not make it go all the way away. But after 2 days, you shouldn't still be throwing up. Then I want to see you back. But that should be clear in your head, when you need to come back and what you should watch out for.
And it seems like typically, too, when you make an appointment, they'll say, make sure you bring in all your medications. Why is that? And I think people think, well, this maybe is not, they don't need to be concerned about that. But, I mean, why should you bring them in?
So what's really helpful, it doesn't necessarily have to be the bag of medicines, which is absolutely helpful. But if you have a list of your medicines and their doses. So one of the things people they'll say, I'm on this medicine, and they don't know their dose. So let's say you have very high blood pressure when I see you. If I don't know what dose you're on, I can't increase your dose. I can't help you with that problem. So it's really helpful to know. The other thing that those medications tell me is if you're on a low dose of a medicine and you have high blood pressure and you're on a very low dose, I know your normal blood pressure is not a lot higher. Whereas if you're on 5 blood pressure medicines and you're on the highest dose, I'm not surprised that your blood pressure is a little high, because it's very difficult to control your blood pressure. So what medicines you're on tells me a lot about what your medical history is. Not just that you have high blood pressure, but how severe is your blood pressure.
Well, great information. So if people want more information about health literacy or about dosage and things like that, and then also about the urgency room, they should just go online? And
yeah, we have a website, and please, if you have any questions about any visit, you should always call your doctor back. They always have a nurse or a doctor available to answer your questions, and we do at the urgency room as well.
And you're not going to be bothering them. That's what they're there for.
You have to call. Yeah, absolutely.
Well, Dr. McClain, always great to have you with us. Always good information. Thank you.
Okay, thanks.
Well, we've stepped out of the TV studio and we're into the kitchen, and joining us is Chef Jeremy Reinicke with the HealthEast Waste Wellness. Thank you for being with us.
Absolutely, thank you for being
here. And
here.
we're literally right on the Woodwinds Health Campus. The hospital is just across the parking lot. Tell us about this unique, having a kitchen, well-being classes right here on the health campus.
Yeah, this is really unique actually. Our mission here at the kitchen table is to help folks do more cooking at home, using more whole fresh foods, and kind of eliminating or even just reducing. We believe in baby steps, right? Even just reducing those convenience-based foods full of the fake stuff, right? The fake colors, all that kind of stuff.
It's amazing too, the processed foods, how much salt and sodium and sugar that you wouldn't even think things would have sugar in them, and they do. Yeah.
Yep. People don't even realize how much is in those processed foods and those convenience-based foods. So we're all about cooking whole, fresh foods.
This looks delicious. So what are we cooking here?
Thank you. So we're going to make today. This is really simple, and that's also kind of part of our mission here. Is we keep it simple. We use few ingredients. We don't want to use anything that's really difficult to find, right? We use simple methods. So we're going to make a sautéed salmon with some fennel, and then we're going to dress it with some tarragon, which is right here if you're unfamiliar, and some capers, and then some orange juice and a little olive oil. And that's it. Well, some greens, of course.
Wow, this looks great. So let's get going.
All right, let's do it.
Okay.
So it's really important, you guys, to preheat your pan, and I've had this one preheating, so we're good to go. We're going to use a very neutral oil here, as opposed to your olive oil. You want to avoid using those deep, dark oils for the high heat techniques, because they may burn on you. So you want to use these that are light and kind of see-through almost.
So what kind of oil is that?
So this is a canola, and we now know that, of course, canola oil has some omega-3s in it, which kind of aligns it with an olive oil. So it really just makes sense whenever you're sautéing anything to use that canola oil. Again, that olive oil can burn on you and make your food bitter, and we don't want to do that.
So when would you use the olive oil? Not for the cooking part, or when you're going to use really hot temperatures?
Correct. So you may very gently sauté or sweat something in olive oil, but be very cautious with your heat. Or just dress it. We're going to dress our greens with this beautiful olive oil.
I love the flavor of olive oil.
Yes, absolutely. And if you don't add heat to it, it doesn't lose or break down any of its flavors. So that's really important as well.
All right.
So we've got our oil in here, and I always add kind of just enough to lightly coat the bottom of our pan. So we're going to go ahead and place our fish in here. We have some beautiful salmon.
It looks awesome.
Yes.
So did it come that way, or did you have it prepared?
I bought a side of salmon.
Okay.
And then I broke it down into the portions. Yeah. You could take the skin off. You could leave it on. That's really kind of up to you.
And that's about the size that you would say is a portion that we should be eating, about like the size of a...
Yep. Like a deck of cards, they say.
Cards, okay.
Yeah, is a good portion. So for our veggies, we have our fennel here, and if you're unfamiliar with fennel, some folks kind of think it looks like dill, right?
You're
but
right.
It's not dill. It tastes nothing like dill. So we're going to use the bulb here, but we're also going to use the greens for garnish. Okay? So it's a good idea to use the whole part of the plant if you can.
And that is the secret, the seasoning of whatever you're preparing.
Absolutely. Yep. Seasoning it properly, flavoring it properly. Healthy food does not have to be boring or bland. I know, right? It's earth-shattering, isn't it?
We want it to be delicious.
Yes, absolutely, and it can be. It absolutely can be. So we're just kind of slicing thinly our fennel here, and then this is going to go right into the same pan here as well, right?
Okay.
I mean, that just kind of makes sense, doesn't it? We'll have an exchange of flavor, and then we have one less dirty dish, too.
Yep,
Yeah.
I like that.
Yeah, right? So this is
I like to clean as I'm going.
Absolutely, that's really important too. So this is just going to kind of go in and go around our salmon here, just like this. You do want to control your heat a little bit. Don't get it too hot if it's popping and cracking at you. Turn it down a little bit, but you do want to maintain that nice little sizzle.
And you keep it open, not covered.
Yep, don't cover it because we're actually going to caramelize or lightly brown that fennel. And if you cover it, that won't happen nearly as well.
Right.
Okay?
I still remember my earlier cooking, and I'd be calling my mom, okay, now do I put the cover on, or do I keep it off, or how long do I simmer it? You know?
Absolutely. People don't realize that it really does make a difference, whether it's covered or not. So that's working away really nicely here. We're going to go ahead, and I just washed this, so this is a little damp, but we're going to trim and chop up just a little bit of our fennel fronds for a garnish. So just like that. And again, that's just going to be a nice little garnish to go on top. So we don't need a ton of it. And that will dry out too. If you just wash your fennel, for example, and then it's a little wet, just let it sit out like this for a few minutes, and it'll dry out for you.
Okay.
Okay, looking good. This is looking good. You can kind of see we have a little color starting around that salmon there, which is what we want. We're going to go ahead and we're going to dress our greens real quick. We're making the vinaigrette right in the bowl. Okay? No need to make a whole bunch and then sit on it in your refrigerator forever or even end up throwing it away. So there's our greens. We're going to toss in our tarragon. And again, I just chopped our tarragon, and that's this guy right here. Yeah, beautiful, isn't it? Tarragon.
I feel like I don't have smell on it.
Yeah, I know. Tarragon actually has a similar flavor profile to fennel. So it's a really nice, like it makes sense for these two things to go together. Yeah. And then we're going to take a little chopped caper here. So these are caper berries. They're actually, if you look super, super closely, they're actually like little flowers, kind of. Okay?
Oh, okay.
So that's going to go on. It's going to bring a nice little kind of brininess to our salad here. And we're going to dress it with the acidity here that we're using is going to be orange juice, right?
Really?
Yep. You can make a vinaigrette with citrus juice. Okay? So we're going to squeeze That one wasn't super juicy, so we're gonna squeeze one more. If you have a really nice juicy one, you may only need one. But we just want enough to kind of lightly coat our greens there. And then we're gonna toss that with a little extra virgin olive oil. Now we're using that extra virgin olive oil,
Okay.
right? Ooh, can you smell that orange too? We're gonna take a peek at our fish here real quick.
So when you're checking for this, what are you looking for?
So for this, at this step right here, I'm really just looking for a little bit of color, a little bit of brown. And we have a little bit. As you can
Oh, wow,
see,
that looks good.
right?
Yeah.
Yeah, nice little browning there. I think we're actually gonna flip it. You could let it go a little bit longer. It's really up to you on the amount of color that you like. And you can see that fennel too is starting to brown here as well.
But keep moving it so it doesn't burn.
Just move it around a little bit, yeah, so
Okay.
that the rest, like this part of the fennel, maybe that can get some contact with the bottom of the pan. And then that'll brown as well. Beautiful. Now we can start to smell the fennel too. So we're just going to take a little drizzle of olive oil on our greens there. And we're going to toss with a little salt. Now, whenever you're dressing a salad or greens, whether you made the vinaigrette or bought it even in advance, or you're making it right like this in the bowl, you never want to add so much stuff, right, juice or oil, so that there's a pool in the bottom of the bowl.
Right. I mean, I'm so used to when I do go out to eat, I have it always on the side because I don't know how much they're going to put in there.
Exactly.
Yeah.
And if you're at a really reputable restaurant, like you should be able, they'll know that, right?
Yeah.
But yeah, you just don't know sometimes what's going to come
Right.
out. So this looks really good here, actually.
Okay.
You can see we got just a nice little sheen or shine on there. Bottom of the bowl is
Wow,
clear.
that was quick.
Yeah, right? Super fast. And then, of course, it's really important, right, to taste your food. Taste
Yep.
it as you go. I'm going to take a little bit. Super nice.
Needs more.
I'm actually going to squeeze one more orange in here. Yeah.
And I think the salt that you use is, why don't you tell us about that?
Yeah, I use kosher salt. It's kind of the standard for a lot of chefs and restaurants. It just, from a functional standpoint, it works really well. Iodized salt is little kind of
I love the
bouncy
smell
balls.
of those oranges.
Yeah, I know. Little bouncy balls, and they kind of just bounce off your food. Kosher salt is very rigid, and it sticks to your food very well.
Oh, okay.
Yeah.
Good point.
All right, there's our greens. Take a peek quickly at our salmon, and I'm thinking we're done. You'll see a little bit of that there, right? That's kind of some of the fat coming out, but
Okay.
it's good fat in the salmon, right? The omega-3s
Right.
are in there. And then if you want to check it for doneness, I always just kind of flake it apart a little bit. Just pull it apart slightly like that, and if it looks done, you're in
And
good
done
shape.
means?
Done
what-
means no more of that bright pink in the middle.
Okay.
Yeah, yep. So there is that. We're gonna plate super fast.
We're getting into our couple of final minutes of this segment. So you teach classes here?
We
right
do,
at,
yep.
Right at the kitchen.
Right here, yep.
And
we teach group cooking classes, which all have an element of hands-on. Some are a little bit more intensely hands-on, like our knife skills class. You get to come in, I do a demo for you, and then you actually do the production.
Yeah, and I've admitted
you
that I've
have.
taken these classes
Yeah.
before and I love them.
Has it helped?
Yeah, oh,
Good.
absolutely.
Awesome.
Yeah.
Even just how to hold the knife, right?
Well, and using the chef's knife
Yeah.
as opposed to using my little paring knife.
Right, the right tool is very
Right.
important. So we've got our greens here. I'm just gonna do salmon right on top like that.
Oh, awesome.
And then we're gonna do some fennel. Just right on top of that fish.
Wow, that just looks beautiful.
Doesn't it?
And it smells incredible.
And then, what do we do? Our fennel. Fennel fronds.
And you just kind of sprinkle that on
Yep, just a
there
little
then.
sprinkle to kind of green up the fennel bulb.
Wow.
That's it.
And
Super
how
simple,
much time
right?
to prep all of this then too? It didn't seem to take that long.
No, previously I did probably 5 minutes worth of prep.
Okay, good.
Yeah. So it's pretty simple, easy, quick, right? That's what people love. We don't want to spend hours and hours in the kitchen, or most people don't.
So if someone's interested in taking your classes, how do they go about doing
Yeah.
that?
So in the back, you can go to HealthEast/Ways to Wellness.
All right.
Yeah.
Chef Jeremy, thank you for being with us again. It's been awesome.
Absolutely.
And inviting us into your kitchen.
Yes.
So really,
Thank you for being here.
it's been great. Thank
All right.
you.